And with that, I turn it over to our speaker, Stephanie Cohen.
Hello, thank you for coming. I am Stephanie. I'm so honored to be here, and I just want to thank all of the people that made this happen. I really love working with people who love supporting families and supporting eating and development and just overall well-being. So when I was asked to present this talk here, I jumped at the chance, and I'm just so happy to be here. Traverse City is also a very special place for my family. I'm from Illinois, but I'm going to pretend that I'm from Michigan because I love it. So I'm just going to tell you a little bit about myself, and then I'm going to share with you a lot of information. And what I want to share with you before I even start is that all of the information in this talk is evidence-based. I've got lots of citations and resources for you. At the end, there's going to be a QR code that you can scan. It'll take you to a landing page where everything is there for you. I am not going to deep dive into studies, and my goal instead is to have you, or hopefully offer, resources that you can use when you go back to work with your families. So what are the things we can do to support all children and all families? So my non-financial disclosure is that I'm the co-director and co-founder of a nonprofit called the Chicago Feeding Group. And the Chicago Feeding Group began with a group of early intervention therapists in Illinois who were frustrated that families were not getting connected with resources early enough. They weren't getting connected with high quality resources. And we just wanted to make the community better in Illinois and Chicagoland. And then when the pandemic happened, we went online. And so now we just have professionals and families joining us from all over the world because our biggest mission is supporting families. So we offer educational opportunities that we offer for free to families. And it's very close to my heart. And so I might mention it. You'll probably see some information about it in here. My financial disclosures is that I am the founder of a company called Get Permission Institute, and I have a private practice in the state of Illinois where I work with parents and families, and I also wrote a series of books, and you might also see me somewhere on social media under Learn to Talk with Me. So there's a lot of different things I do, but the reason I do all of it is because I want to support families and connect them with resources that they can trust, that can make a difference. These are the people in my life that I just love the most, and so I show them to you because I come to you as a speech-language pathologist and early intervention provider, but I also am the mom of 3 boys, and I did some things that probably really didn't set them up to be intuitive eaters or have a great relationship with food, and then other things I'm a little prouder of. So I'm going to share some of my mistakes with you, but I just want to say, before I get too much further into this talk, so the name of the talk is Celebrating Individuality and Supporting Intuitive Eating in Neurodivergent Children. What I want to share with you is that this talk is built from experiences that I've had, but primarily from lived experiences of a variety of parents and neurodivergent adults. And the reason for that is because I recognize I have life experience, right? 2 of my children are neurodivergent, and I am, so is my husband. There's a lot going on in my house, but I don't have the same experiences that other neurodivergent folks do, or parents of neurodivergent children. So I'm pulling in resources and voices from everywhere that I can, and then directing you to those resources to continue learning. Because as you all know, we learn best from people who are living life with their own sensory systems and their own bodies and their own capabilities. And so I really try to learn from as many sources as possible. And I know I've had such great conversations with some of you, and I know that there are a few of you here who are parenting autistic children, and many of you probably have neurodivergent people in your life. So I would love for this to be a conversation as well. Those 2 guys in the middle are my sweet dogs, and that's them waiting for us to leave because they intuitively know there's food on the counter and they want to eat it. So we really have a lot going on. I'm so excited to meet all of you because you really are the front line in supporting families. And I know you know that, you don't need me to tell you that. But I know that oftentimes you are the people that are connecting parents with resources, with food, with social support services, and you can't, as a parent, support a child in their journey of learning to eat if you don't have your needs met, right? And you don't have access to resources basic needs. So you're going to hear me talk about kind of that part of this, because I believe that the way to support neurodivergent children is to support the parents' and families' capacity to offer their children food, right? To have meal times where they're able to connect. They're able to provide those opportunities for learning. I always start my talks by just asking you all, what do you think about when you think about eating time? Can you just like shout out a couple things? And if you don't want to and you're shy, that's okay too. Well, like connection. Thank you. It's first on my list. Anyone else? Bonding, yes, absolutely. You can see that in this picture. Family, is that what you said?
Yes.
Someone back there? Thank you, yes, family. Anyone else?
Culture or ethnicity.
Absolutely. Nourishment, yes. Calories, food, all of those things. Skill development, I have a whole list. Connections first. But giving and receiving love, socialization, exploration, sensory learning. This is going to be a big theme throughout our conversation today. And opportunities for skill mastery. And there's probably a million more descriptors that we could use as we think about our own mealtime experiences growing up and now and maybe with our own families. I will be completely honest with you, intuitive eating is not a concept I use in my practice because I work with babies and toddlers. So when I agreed to do this talk, I said, okay, I've got to like kind of figure out exactly what this is and what this means and how it integrates with what I do. And what I realized, are most of you familiar with this book? Okay, so what I realized is that it overlaps almost completely with the way I approach my work with families and learning around mealtimes. So these are the 10 principles that I wanted to just flash up here. I'm not going to go through them all, but the ones that stood out to me that related to what I do are honoring hunger. And the word interoception is in parentheses there. Is anyone familiar with that term? Interoception is like your sense of the feelings inside your body. So it could be hunger, it could be fatigue, it could be fullness, it could be pain. All of those things that kind of signal to your body and your brain, I need something. And when we think about folks who are neurodivergent, this is a big challenge for many of them, is really managing the sensations that are coming from within their body that are telling them, hey, you need food, you need this food, you need that food, you don't need to eat right now. So that's another theme that's going to come up. Respecting your body and really like accepting the body that you have. This is perhaps an adult concept, but I think all of us are super aware of this in the parenting realm, right? Is parents who are worried about maybe their child isn't growing the way they expect, or maybe their child's growing differently than they expect. And so I know we all do work to help parents understand who their kids are as individuals. So a lot of these factors overlap with responsive feeding. And can you just raise your hands? Has anyone heard of responsive feeding before? A few of you, a lot of you, great. So responsive feeding is an approach to helping children learn about eating that really centers these values that I've put on this slide. And what I want to say about responsive feeding is it's not like a therapeutic approach where like some clinician has said this is my approach. It is a research-based understanding of how children learn to eat and how that positively impacts long-term outcomes. So there's a lot of responsive feeding information in the literature about kids who are having difficulty eating, about its relation to long-term body size and diet variety. So when I think about responsive feeding, I think about these core values, which is from a paper that goes much more in depth. Autonomy. As a child learns to eat, we want them to feel independent and make choices based on what they are learning or hearing or feeling from their body. Relationship. So you know, based on the discussion we just had and just how you feel, that eating is happening in the context of the relationships with the people that you eat with, right? And so we'll get into that a little bit more, but we really prioritize considering that relationship and how it's going. Competence is like the skills. Can I pick up a spoon and get it to my mouth? Can I take a bite and can I manage that bite and figure out how to swallow it or when it's ready to swallow? So it's that child practicing over and over again and getting good at different things and figuring out what they love and what's not right for them. Oops, and intrinsic motivation. This is like the big one. I think a lot of parents in our world think that it's their job to get their kids to eat. And not in a negative way, but maybe they don't quite know that most babies, if nothing gets in the way, are born with an innate ability to self-regulate and learn over time. And that intrinsic motivation oftentimes is built in. Now, things that happen to children that I work with, like medical events, prematurity, breathing issues, cardiac issues, that gets in the way of that. But for most families, there is this notion that I'm supposed to get my child to eat these foods and this much, and they need to be this weight. And responsive feeding prioritizes what is this child motivated to do and learn. And so we'll talk a little more about that. And then holism. Who is this child within the context of this family, their culture, their community, and their resources? So it really overlaps a great deal. It mirrors the principles of intuitive eating, but it's more appropriate for young children. So responsive feeding helps preserve the intuitive eating skills babies are born with, if it's not interrupted. And intuitive eating helps adults kind of reclaim those natural abilities that may have been disrupted by all the noise in our culture, right? And so responsive feeding is shared and promoted and endorsed by some pretty big organizations. So again, it really is evidence-based and best practices. I'll have a lot of responsive feeding resources for you, for yourself, and also to share with your families in the resource list. Okay. This is what it looks like.
Okay, Papa. Oh, that's it. Oh, okay. Puppy, hey. Smoothie? Okay. That's yummy. Bravo, Puppy. That's yummy. Mana Puppy solito? Solo? Solo? Yummy puppy. That was perfect, man.
But can you see what responsive feeding feels like? I can describe all the values and all of these things in the research, but this is what we want for our families. And this dad gets his son. And so you can see there's no pressure. There's communication and connection and love, and he's responding to his son based on what his son has just done, and he's supporting him just enough so his son can say, yes, I'm ready for this. I want to do this. So the responsive feeding, I think I said a lot of this, but both responsive feeding and intuitive eating prioritize hunger and trust natural hunger regulation, respect bodily autonomy. There's no pressure or restriction. There's a focus on recognizing internal cues, creating positive mealtime experiences. That's where internal motivation comes from, to come back to the mealtime again and again and again. If you have a positive experience and you're a baby and mealtime feels good, next time you start to figure out, oh, mealtime's coming, you're gonna be happy and you're not gonna be fearful or feel scared. Avoiding good and bad food labels and labels of children, right? We'll talk about language. And then long-term healthy relationships with food. So this is a resource developed by the Chicago Feeding Group. It's free, you can download it. It's gonna be linked in the resources, but it's an open access parent fact sheet for different age ranges. You can use them and share them with your families. And we're really proud of these. And again, did I say they're free? They're all free. Okay, milestones. I know you all in your work are thinking a lot about milestones, right? Because now, if I'm correct, the way that you interact with families is over a span of like months, right? You see a family and then you might not see them again for how long? Okay, so you're not necessarily doing the therapy, right? But your touch point is so important to families who may not have anybody else who's asking them about how mealtimes are going. But I know at the same time, those visits there's gonna be a discussion of what's your child doing? Are they doing this? Are they doing this? Here's what's next. And so these are the milestones that were put out last year from the American Speech Language Hearing Association, and they're great milestones. They're great as a frame of reference that we can tuck in the back of our minds, and they're information. They're not prescriptive. They're not a roadmap. These are some of the things we see some children doing around this age and this age. These are also free. There's like printables, but I use milestones very, very carefully because probably even more so than your work, the kids that make it to me are having problems, right? They're coming to me because something doesn't feel right or it's not going well. So I am not there to say, well, let's check off the things on the checklist. I'm there to say, hey, let's think about how eating develops over time. So I'm sharing these with you, but I'm not telling you to use them in a prescriptive way, but you don't need me to tell you that. You already know that. Feeding skills are developmentally acquired. I'm going to tell you a little bit about just sort of how I think about feeding development. Children gain skills through just right opportunities. Has anyone heard of the Just Right Challenge? Just Right Challenge is the right experience to help you learn what's next. So it could be, I know how to eat this kind of cracker, and maybe my parents are going to give me one that's a different flavor and feels a little different in my mouth. I know a little bit, I've got the skills, so I can maybe expand my variety. It could be, hey, we're introducing you to foods, here's a spoon, you can figure out how it works in your hand and you can explore it. It wouldn't be the Just Right Challenge to expect a new eater to completely feed themselves, right? With a spoon. They may be doing so with larger pieces of food as they're learning. So the Just Right Challenge is something that we really want to support caregivers to think about, because a lot of parents get to me and they're like, my child won't eat, meats, and their chewing skills are pretty delayed, and they've got some low muscle tone and they're pretty weak. And that wouldn't necessarily be the thing I would expect them to be good at next. It's not the Just Right Challenge, but caregivers and parents, oftentimes they don't hear about this. We want caregivers to know it's not their job to get kids to eat. It is their job to provide opportunities and then watch and observe and see what their child is ready for, what they lean into, what they love, and that helps them determine the direction, right? Within a framework of, generally speaking, we hope your child maybe learns to add new foods to their diet, learns to chew. All of those things are in the background, but specific sort of prescriptive, this is the next food, it's not really how we're thinking about it anymore. Okay, let's see. Oh, that is hard to read. I am so sorry. It is darker on my computer. So this is another visual of how I think about the progression of eating. And the thing I want to point out to you here that I haven't talked about is safety and trust. Safety and trust is the absolute foundation of learning to eat for any child, any body, any sensory system. How many of you have worked with kids who were born prematurely and maybe had breathing problems? Maybe spent some time in the NICU. And in the NICU, there's a lot of focus on your child needs to be able to eat this much before they go home, right? And usually that is not in line with what a baby, is ready to do. But it's a metric, right? And so that child might have experiences where they're pushed a little harder and they aren't as coordinated, and it feels really scary for them. So if you can think about kids who have been through experiences like that and lots of other things, they're not going to trust their body and they're not going to feel safe in a feeding experience or a mealtime experience. So from a child like that, to a child who we may view their eating development as what we might expect, the foundation is feeling safe. Like I can trust my body not to aspirate or throw up or gag. I also can trust the person I'm eating with not to make me do something that I'm not ready to do, or eat more or less or differently. I think it is hugely consequential for all of us. It is also hugely consequential for those of us who are neurodivergent, right? Because there are a lot more opportunities for us to feel unsafe and not trust the folks around us who are trying to maybe get us to do things that they don't understand we're not ready for. When we're safe and we have opportunities and we're internally motivated, we build our skills, and then we become really confident, and then volume comes, right? And for some kids, it happens really easily. For other kids, they just need more time. Okay, eating is a sensory motor activity. So think about the babies who are just learning to eat. What typically happens during those meal times? Mess, yes, thank you, absolutely. Inefficiency, right? Lots of mistakes, banging, dropping, all of those things. There is a developmental purpose to that. And the developmental purpose is I have to take in all this information through my sense of touch, what I see, what I smell, what I hear, what I feel in my mouth. And that tells me how to get better at putting something in my mouth just enough to take the right size bite, or feeling in my mouth that the bite I have is ready to swallow, or orienting the spoon in just the right way. Mess is a huge, huge issue for probably all of the families you work with, because mess equals waste, right? And if I don't have enough food to allow my child to make a mess, it's probably a little bit gonna cause me some worry and some stress. So we're gonna get back to that too. But these are experiences that happen in development, right? Okay, now we get to neurodivergence. So when you think of the word neurodivergence, what do you think of? Autism. I think that's the thing people think of. I heard you say myself. Thank you for sharing that. Sorry if that was uncomfortable for me to, like you said it and I was like, what did I hear? Everyone thinks of autism, right? That's the one we think about probably the most and we hear so much about. Anybody else? Anything else you want to throw out?
ADHD.
Yes. Mm-hmm.
Dyslexia,
Yep.
Sensory.
Yep. Sensory.
PTSD.
Yes,
AIA
absolutely.
score.
Mm-hmm. Down syndrome, any chromosomal abnormality, really anything that impacts how your system functions and how you learn from the world. So the definition that I pulled out is any form of neurological functioning that diverges from dominant societal norms, standards, and expectations. This is a quote from Sunny Jane Wise, who is a neurodivergent educator and I was listening to an interview with them last night, like the brilliance. I referenced them in my list at the end. I highly encourage you to listen to their interviews. And then they talk a lot about neuroaffirming care. So this quote is, neuroaffirming care has application to our entire caseload, the vast majority of whom fit under the definitional umbrella. So when we think about neurodivergence, some of you shared some of these things, but we might see differences in functioning in all of these areas. And so there are things like motor development, sensory, communication, cognition, attention, those things that are talked about a lot. But what about sleep patterns and growth and GI function, right? We know how many how many autistic people we have realized have underlying GI issues that often go undiscovered, right? And undiagnosed until they've done a lot of damage. And then other factors related to medical conditions and of course, eating. That's why we're all here. So all of these things impact eating and meal times. Oh, I don't know why that popped up last. Interoception, I mentioned that initially, but just being able to manage and respond to your bodily sensations. So this is Laura Helfeld. Laura Helfeld is a neurodivergent nurse and educator, and they live in the UK. This is a snippet from an interview that they did with my mentor, Marcia Dunn Klein, who's an occupational therapist. So the Get Permission Institute basically is an online education platform, and one of the things that Marcia has done is a series of lived experience interviews, because we recognize that this is the way that we need to be learning about neurodivergent experiences. And so this is just one snippet, and these are free too, so you can watch these if you want to. Let's see if I do this, will it play?
Every single person, no matter who they are, is so different. And then they immediately then are this different being within a family group, and their needs is always going to be different than the next family. So when we get in there, there's no rules we can ever go through with a tick box and say, it's going to be this, it's going to be that, black and white. It's always gray. Even when we're hoping to be able to grasp at some of those ideas, it always needs a shift and move and be really flexible.
I mean, how perfect is that? I'm so grateful that Laura, they do a lot of teaching. There's a lot of online resources that they share, a lot of advocacy work, and I could just listen to them forever. So let's talk about ableism. Is this a word you all are familiar with? Okay, we can't talk about neurodivergence without talking about ableism, right? So ableism, this is one definition, there are many, refers to a system of discrimination against people perceived to be disabled based on socially constructed views of normalcy, productivity, desirability, intelligence, excellence, and fitness, and there's many more things that ableism is rooted in. How do we help parents kind of push back or think differently as they're getting all of these ableist messages about how their children should be eating? And I should say, maybe also how they should be eating, because neurodivergence is highly heritable, genetic. So it is likely that if you are supporting a family with a neurodivergent child, that there could be a caregiver who also may be neurodivergent in some way. So ableism, how does it impact eating expectations? I love that you guys are like shouting out things. Is there anything you can think of that's kind of an ableist expectation of eating?
What do you mean you don't like this texture? I got that one a lot as a kid.
Yeah, absolutely. Like, how do you not like it? It's delicious. It's so good. Anyone else? Or feel free to share more.
Using utensils.
Yes.
Finish what's on your plate.
Finish what's on your plate.
I'm not making more than one thing.
Yes, this is what I made, and this is what you're going to eat. And, well, I'll go back to that. Anyone else?
Eating in the same place as everyone else.
Yes. Can't get up from the table, but my body can't stay in one place because it needs to move.
4 more bites.
Yes. You're my people. I already knew that though. So I have lists, mealtimes. And now I want to say, we're working with kids at the youngest ages. And so it's not that we're saying no more mealtimes, it's okay, you don't have to have any mealtime structure at all, because some kids, many kids, most kids, that's what's going to work for them, right? It will work for most kids. What we're saying is, this is maybe what we might start with, but if I hear you tell me you're struggling, we're going to talk about options, right, and who your child and family is. Dietary diversity, these are a lot of things you all said. Trying new foods, self-feeding, schedule, eating in different environments, socializing and communication, use of screens. Do you all have lots of kids coming in and parents are like, I can't get them to eat unless the iPad is on? Me too. And I think that parents are getting messages that they're failing and they're a bad parent and they're getting that message from themselves. But it is very, very possible that they are parenting a child whose system cannot regulate to manage the incredibly challenging sensory motor task of eating unless they have outside input. The very concept of mealtimes is incredibly ableist. It assumes that mealtimes are the places we should be eating. So we'll talk a little about that. Laura has something to say about that. Ableism, language, and eating. So I'm going back. What do you hear parents say? How do they describe their kids when they're feeling stressed and challenged?
Picky eating.
Picky eater. Yep, I heard picky eater.
Dramatic or diva, I hear that a lot.
Yep. Or like stubborn, refusal. Anybody else?
Wasteful or lazy.
Lazy is such a big one. Yes. Negative behavior, slow feeder, difficult to feed, refusal, avoidance, aversions, restriction, grazing, unable to eat in different environments. That one's going to keep coming up. Screen-dependent uses, distractions. They're very negative terms. And so I don't actually think you need me to tell you this based on the vibes I'm getting, but what I hope is that our conversation today can help you leave with nothing else other than a non-judgmental stance and a reflection on helping parents think about language and using your language to help parents reframe and think about their children differently. Oh, oops, I was supposed to do that here. Okay, we'll keep going. Okay, so what's neuroaffirming care? I kind of already started talking about it. Brains work in different ways, and while some ways might fall outside of the dominant sociocultural expectations, this does not mean they are bad or wrong. Rather, neuroaffirming care validates that neurodivergence is simply a different way of being human, and seeks to offer supports where they are truly needed rather than, this is the big finish, trying to get neurodivergent people to appear and behave more neurotypically. Okay, this is a graphic that Sunny Jane Wise has shared, and it talks about all of the different aspects that they think about as they consider and teach about neuroaffirming care. So this is in your references, but if you can read this, I know it's small. They talk about honoring all forms of communication, adapting systems and environments, nurturing positive self-identity, prioritizing lived experiences, interoception, rejecting neuronormativity, promoting self-advocacy, reframing, presuming competence, validating differences, respecting autonomy, and intersectionality. Because everything else about our lives and who we are intersects with neurodivergence, right? And impacts our ability to function. So the question is, who knows best what's right for this child? And is there a right way to eat? So who knows best about what's right for a child? The child. Okay. However, there's a lot of research on lived experiences of families who have children with feeding challenges. There's a diagnosis out there called pediatric feeding disorder. It actually can be used as a diagnostic term. It's in the ICD-10 or whichever one's the most recent. And pediatric feeding disorder acknowledges that feeding challenges are multifaceted. There might be nutritional concerns, medical concerns, feeding skill concerns, and psychosocial concerns. I would say, as I'm sure all you would, is that when feeding challenges are present, there are always psychosocial concerns because you cannot pull out emotion and relationships from all of the things that might be happening in another domain. So there is a very large body of research that looks at the impact on families right there at the top. There is a significant financial burden when a family has a child who struggles to eat. There's the cost of food, the cost of medical services and care, there's the cost of not being able to work because you're the only person that could feed your child. And so when the folks that we work with already need resources to address all of the things they need in their life, and then on top of that they have a child that struggles to eat, perhaps because they're neurodivergent, but also for a number of other reasons, their finances are strained even more. Caregivers are stressed. Families might be isolated because people don't understand why your kid's not eating. Like, just make them eat. Make them eat what you serve. Stop giving them other foods. So there's a lot of misunderstanding. Parents are misunderstood. There's conflict between caregivers. Do you all ever meet with more than one caregiver in a family? And have you had the experience that like one parent thinks one way is the best way, but the other parent disagrees? And this is such a huge factor because eating is so hard for everyone that if parents have conflict, it impacts their entire day, not just mealtimes. There could be confusion and shame because I'm a bad mother or parent because I can't nourish my child. And there could be a higher frequency of what we call adult-directed practices, so non-responsive feeding, trying to get you to eat more, get you to eat differently, deciding how much you need. So this is Dennis and Susan. You hear Susan, but you see Dennis. And Susan is going to talk about what she's giving him. She's going to tell you all about her life. And I share this with you because it will give you a sense of what happens during meal times for these families. This mom is incredible in her willingness to share her experiences, but she really just describes the lived experience of so many of our families who are so stressed. And the thing about this relationship and what she shared is she knows what she's supposed to do. He's supposed to feed himself. She's supposed to let him get messy. She's not able to do that. So just imagine the emotional experience that she's having. This is a quote from a lived experience study that talked to parents and asked them how they felt about not being able to help their kids learn to eat. And I apologize for the lack of contrast. This is not how I would design it if I knew it was going to come up like this. But not being able to give your offspring nutrition and food, that's something built into parents' primary driving force. It's like a constant failure every day. So when we meet with families, we can learn what does this caregiver have to do to enable their child to eat. And they're doing those things because they're working. So I think about this particularly with use of screens. If you are a desperate parent and you're so scared that your child's going to be hospitalized because they're losing weight and they'll eat when you turn on the iPad, what are you going to do? You're going to turn on the iPad. And we have to respect that parents are working so hard to help their kids be nourished, and these kids just have different systems and different experiences. This is Marcy.
Kind of ate separately. He ate different things than our family and in a different place than the rest of our family. And he only ate for a long time with an iPad. And he only ate very specific foods. And it was brand specific. And I remember just being paralyzed with fear that what he ate, they would change the packaging of, because that was going to cause major problems in our life when the Eggo waffle people changed the packaging of, you know, the waffles that he ate, or if they, God forbid, you know, tweak the recipe, he would notice.
Can you imagine? I mean, some of you in this room have probably had the experience of being the person who your favorite food has changed. But the fear that these parents have when their child eats 4 foods and they change even the packaging, even if it's the same food, kids make decisions based on visual input. So even the change in the packaging, it has to be the perfect color of brown to tell that child this is going to feel the way I expect in my mouth. Parents are fighting for resources because they know something about their child is maybe different than they expected. You all know all this. I'm going to breeze through this because I have 15 minutes left. But when I work with families and when you work with families, I know we're thinking about the intersection of all of these areas, right? We're thinking about family-centered care and what can we do to support this family so that parents or caregivers can be responsive, and can we support families' responsiveness while honoring what they prioritize and what their cultural values are and family practices, and can we also be trauma-informed? And so it's hard to balance all of these different things. We just keep thinking about them and working and learning as we support children and families. And we know that disparities exist in certain populations in terms of access to family-centered care in particular. And so our attention and intention can really go a long way towards helping all families, but specifically certain groups, have improved care. Parents of children with ASD or internalizing disorders also report receiving lower quality family-centered care. So you can see the intersection, it just piles up, right? The disparities in support and access to care. I said this in the beginning. Okay, so here's what to do, because I have like probably 12 minutes now. So let's be curious. We're gonna support families, and we can help support caregivers by being curious, not being the only expert in the room, but being curious. Who is this child? What do they love? What experiences have they had? Who is this caregiver in this family? What are their sensory systems like, the child and maybe the caregiver, right? What do they love? What is hard? What accommodations are helpful? These are just some questions to prompt thinking and conversation. What resources might help? And I say community, not just meaning community resources, but also finding community. So what I have heard from neurodivergent folks who share their lived experiences is when they found the neurodivergent community, they all of a sudden just felt heard and seen and understood, and just connection, right? So community is really important. And then lastly, what is doable? So as you all make recommendations, I know you have like a very specific list of information, things that you need to share with families at each appointment. But I know also that you're doing that within the context of sensitivity and with a family-centered focus, so that you are a source of support rather than a source of stress, which, I mean, I certainly have been that at times. How have you blended the idea of being neurodiversity affirming with the information that you need to communicate with families? Have any of you had an experience where you had to kind of frame things in a certain way or respond to what a parent has told you in a certain way?
I think it should be the standard to, because I mean, if you direct the care in the form of like that it's going to work for a neurodivergent family, it's going to work for any family.
That's so true. Thank you for sharing that. Anybody else have a thought or an experience that you've had, or even like a reflection where you're like, oh shoot, I wish I had said this differently? I mean, a million times, right? Me too. Oh my gosh, it's very embarrassing what I have said at certain times. So this is hard. This is a challenge. Maintaining that family-centered focus and supporting the whole family, and there's going to be a couple other things. Here's Laura again. So I'm just going to touch on a couple of big issues that come up again and again when parents have neurodivergent children. These are the struggles they have. Same foods. They will only eat these 4 foods. The Eggo waffles. I'll let Laura say it.
So we tend to call them our same foods or safe foods. And it's a neurodivergent trait, real autistic trait of they're foods that we just have like a really close personal relationship with. Like they're really important to us. They're our favorites. We eat them often, maybe once a day, maybe multiple times a day. And for myself, so the Reese's peanut butter cups are one of my ones right now, and it has been for quite a long time. We typically eat them in a very certain setting or context. And they have just like massive benefits for us. With our community in particular, a lot of that tends to get lost and forgotten.
I think just like that, the systems that have the ableism along with them, from professional settings, we still tend to be thought of from that medical model. And so addressed in that way from the disordered model, and looking at literally that we are made out of this set of deficits, and that therefore what our behavior is wrong. And our behavior, because we are autistic and is an all-encompassing way of being, means everything, including the way we eat, is wrong. So then if you're a professional or parent trying to figure out how to create support from that, it's always from this really negative place. And again, I'm very aware that can be really difficult and food can be hard, but that also really means we need to balance this with the discussions of what's really fun and joyous and silly and just fantastic, because I really feel down to my core that if we are going to create support for an autistic person around food and eating, we have to understand what food joy is for the autistic community, like what is that autistic joy and what creates that safety. And same foods is really such a common trait for us, and a really great grounding foundation piece for supporting someone else or yourself, and just leaning into it and like letting yourself have those moments of joy. And we call them like glimmers throughout the day. Like, why not? You know, why not?
So what if when a parent says, my child will only eat Eggos this certain way, instead of saying, let's think about how we can get them to eat a different brand or eat it a different way. What if we approach it with, why do you think they love Eggos so much? Sounds like they love Eggo waffles, and it helps them to be able to eat and feel really good. It's like totally flipping the disorder narrative and focusing on individuality and helping a parent recognize their child as not from a deficit model, but instead from a who is this child and what do they love? Because we might discover they love this amount of crunch. There might be other foods that have that crunch, and they might work for that child. They also might not, but they might, right? So I'm so grateful to Laura for sharing all of that. So we're going to keep going, and we're going to hear Marcy sharing that someone told her to just add something to one of her son's foods.
I told her he would know. And she kept saying, no, it's tasteless. And I knew even if it was tasteless, the texture would be different. And there were other people who said, add butter to his waffle, you know? And I think by that point, I had been around the block. And I wasn't going to do anything where it wasn't that person who was going to suffer the consequence of that decision. It was me. You know, it was my relationship with Max that was going to suffer from trying to trick him. And I wasn't willing to do it.
So she has the benefit of hindsight. And you know what? I've told parents to add butter to things. Raise your hand if you've suggested adding butter to something. It works a lot of time for a lot of kids. But when it doesn't work, how are we going to think about it? We could try this, but maybe we're not going to try it with the Eggo waffles that are one of 6 foods that he'll eat, because guess what? It will be gone, right? Or she was talking in the beginning about adding like a caloric, supplement to his drink. And this mom knew then, but most parents that we're working with and supporting, they don't understand this. So the value of those same safe foods is paramount. And you can help parents understand that. We're not just going to change or trick or sneak. We are never going to try and trick our kids because they will not trust us. Okay, I'm going to go fast. Family mealtimes is another big one. We touched on that. This is Yannis. Yannis is Greek, and this is from another lived experience interview, and he's talking about his experiences growing up. I'm showing you adults because the kids we work with can't tell us this stuff. And this might not be the kids that you know, but the themes are probably present in a lot of their lives, right?
To be fair, it's not just about my picky eating habits. It's also deeply connected to my autism and the sensory sensitivities that come with it. And in many ways, this private dining space provides me with the comfort and control I need to fully enjoy my meals. And sensory sensitivity does play a significant role in how I do experience food. The textures, colors, and even the sounds associated with eating can have a profound impact on my comfort level. And eating alone allows me to create an environment that minimizes sensory distractions and anxieties. And I just try to ensure that my mealtime experience is as pleasant as possible. Furthermore, as someone on the autism spectrum, I often find relaxation in routines and familiar activities, and eating alone while watching my favorite series on my laptop has become one such routine. And it's not just about the food, it's also about the entire experience, the familiar setting, the comforting visuals on my screen, the solitude that allows me to fully immerse myself in the flavors I enjoy. And in many ways, to be absolutely fair, eating alone is not just a preference, it's a coping mechanism that helps me to navigate the complexities of my sensory sensitivities and autism while savoring the foods I love. And it is actually a reminder that sometimes creating a comfortable and accommodating space for ourselves is essential for our well-being, regardless of how other people may perceive it.
How about that, right? I mean, we as the adults can remember these things as parents come in or caregivers and are stressed and worried because they think they're supposed to get their child to eat in a specific way. And family mealtimes have the best health outcomes. And for many families, they have great outcomes. But maybe for this family, if family mealtimes don't work for this child, at the same time as you recognize maybe why it's not working and connect a parent with resources, and maybe we can connect you with early on and somebody who could help you figure out why mealtimes are hard for him. Some kids have trouble with all the sounds. Some kids have trouble communicating at the same time as they're managing all the feelings of eating. Some kids just don't feel their hunger. So if you don't feel hungry, are you going to eat? Maybe a little, like we probably do, but most kids don't, right, at those earliest stages. So the reframing is absolutely essential. We know the benefits of mealtimes, but are there other times in the day where we can have dedicated time and find those same benefits and points of connection and what's right for this family? So the last thing I'm going to share, 2 more things, opportunities and offers. Again, a parent's job is not to get their child to eat, but to figure out how to offer them opportunities to learn that are right for that child and that individual in that moment. Because one thing that I also have learned from the neurodivergent people in my life and the lived experiences, interviews, and sources is that it changes every day, depending on the stressors in a child's life, how many things are going on, what they have to manage, their ability to eat is likely to be impacted. So how are we flexible and reflective as we think about how we offer opportunities? And then how do we reframe, help parents reframe and move away from negative language and use neutral, non-judgmental languages and maybe redefine goals? Sharing the power in decision-making, right? A parent enters a medical appointment or maybe a WIC appointment expecting to be told maybe or given information about what should happen. But can we work with families to share decision-making power about what they might try? This is from the trauma-informed literature, and sharing the power with families has such an impact on their ability to advocate, be confident, and know that they are the expert for their child. So you're the front line. Those early feeding transitions are key opportunities to identify feeding challenges and provide first and foremost connection, validation, reassurance that this parent is working so hard and their child is thriving because of that work, and you're there to partner and refer them to what they need. You might be the first person to hear about these feeding challenges. Thank you for sharing your time with me. This has been a privilege. Thank you so much. I didn't leave time for questions, so come talk to me. I'm happy to chat. Take care, everyone. Have a good rest of your conference.